Throughout life, our health is influenced by various complex and interrelated factors, and can come from various factors. Welcome to a comprehensive journey regarding the determining factors of health and efforts to maintain optimal health balance. In a world that continues to develop a deeper understanding of how genetics, behavior, social, environmental factors and healthcare are interrelated, which is a factor that influences health, and through this understanding it will help us to take positive steps to improve our welfare, and that of society. There are 4 determinants of health or causes that influence health in society. First, there is genetics. Second, health behavior. Third, society, environment. Finally, health services. Environmental factors are the factors that most influence the occurrence of health problems, because various things can affect health, such as air pollution, climate change and poor water quality. We will discuss and learn everything together. 1. Genetic factors. Genetic factors play a key role in determining predisposition to certain diseases and health conditions. Genetic factors include genetic inheritance received from parents and can influence a person's range of health conditions. The following is a more detailed explanation of genetic factors. A. Family health history. Genes inherited from parents can carry genetic information that influences predisposition to certain diseases. Knowledge of family health history can help a person understand potential risks for genetic diseases. B. Genetic predisposition. Some individuals have a genetic predisposition to developing certain diseases, such as cancer or heart disease. C. Inherited genetic diseases. Some health conditions are genetic and can be inherited from parents to their children. Examples include cystic fibrosis, hemophilia, and thalassemia. D. Response to treatment. Genetic factors can influence how the body responds to treatment. Some individuals may be more susceptible to drug side effects, or may respond better to certain types of treatment. E. Metabolic ability. Genetic variants can affect the body's ability to metabolize various types of foods and medications. This can affect body weight, energy levels, and response to certain diets.
Behavioral factors. In this segment, we will explain how to build healthy habits, create positive routines, and improve quality of life through wise behavioral choices. 1. Diet. Healthy eating habits, including consuming nutritious and balanced foods, can support body function and prevent nutrition-related diseases. On the other hand, an unhealthy diet can increase the risk of obesity, diabetes and heart disease. 2. Exercise and physical activity. Regular physical activity has a positive impact on physical and mental health. Lack of physical activity can increase the risk of obesity, heart disease, and other health problems. 3. Smoking habit. Smoking is a major risk factor for various diseases, including lung cancer, heart disease, and respiratory disorders. Quitting smoking can provide significant health benefits. 4. Stress management. Uncontrolled stress can have a negative impact on health. The habit of managing stress through relaxation techniques, relaxation, or exercise can help prevent mental and physical health problems. 5. Get enough sleep. Lack of sleep or poor quality sleep can increase the risk of cardiovascular disease, obesity and other health problems. 6. Safety and preventive practices. Precautions such as hand washing, vaccinating, and use of personal protective equipment can help prevent the spread of infectious diseases. 3. Environmental factors. Environmental factors have an important role in determining the health of individuals and society as a whole. The following is a more detailed explanation of environmental factors. 1. Air pollution. The effects of air pollution, such as fine particles or toxic gases, can cause respiratory problems, allergies and lung disease. 2. Air quality. Air contaminated by chemicals or pathogenic microorganisms can cause illness through ingestion or skin exposure. Diseases such as diarrhea. 3. Environmental cleanliness. Environmental cleanliness, including sanitation and waste management, plays a role in preventing the spread of infectious diseases. 4. Climate change. Climate change can contribute to the spread of infectious diseases, increase the frequency of natural disasters, and affect the availability of resources such as clean water and food.
Health service factors. Health services are not only a response to illness, but also the foundation for prevention and health maintenance. The following is further explanation about health service factors. Access to health services. Accessibility to health services includes the availability of health facilities, transportation, and health insurance policies. Good access allows individuals to receive timely and effective medical care. Health facilities. The availability of hospitals, health centers, clinics, and other health facilities plays a key role in providing health services. Healthcare personnel. The availability and competence of healthcare personnel, including doctors, nurses, and other medical staff, greatly influence the quality of care. Proper training and support for healthcare infrastructure help improve service effectiveness. Health policies. Good health policies can create an efficient and equitable healthcare system. Public health education. Health education for the public helps raise awareness of good health practices and the importance of prevention. This can motivate people to seek healthcare proactively. In this video, we will explain one type of disease that can be caused by 4 factors, or one of these factors. Tuberculosis, TB. What is TB? TB stands for tuberculosis. Tuberculosis is an infectious disease caused by the Mycobacterium tuberculosis bacteria in the lungs. TB generally affects the lungs, but can also attack other organs such as the kidneys, spine, and brain. In Indonesia, TB is the 3rd most common infectious disease after COVID-19 and HIV/AIDS. Data from 2019 shows that there are about 845,000 terabytes patients in Indonesia. Factors causing hypertension are connected to 4 health factors. A. Environmental factors. Environmental factors play a crucial role in the spread of tuberculosis, TB. Some environmental factors that can affect TB prevalence involve population density. Environments with high population density tend to increase the risk of TB transmission, especially if poor ventilation makes bacteria easily spread through the air. Housing conditions. Unhygienic living conditions, such as cramped living spaces, poor lighting, and inadequate ventilation, can create conditions that support the spread of TB bacteria. Air quality. Environments with high air pollution can increase the risk of TB infection. Airborne particles of pollution can carry TB bacteria and facilitate their spread. Climate factors. Some studies suggest that certain climates, such as specific temperatures and humidity levels, can influence TB prevalence. However, this relationship is complex and still an area of research.
Behavioral factors. Individual behavior can also influence the risk of contracting tuberculosis, TB, and its spread. Here are some behavioral factors related to tuberculosis. Lack of knowledge, insufficient information or knowledge about the transmission of TB, symptoms, and preventive measures can lead to behaviors that increase the risk of transmission, such as a lack of caution in interacting with TB patients. Irregular treatment adherence. TB patients who do not follow treatment regularly or fail to complete the entire drug regimen can increase the risk of bacterial resistance to drugs, complicating treatment and further spreading the infection. Stigma and discrimination. Stigma associated with the disease can make individuals reluctant to seek help or disclose their TB infection, prolonging the duration of infection spread without proper treatment. Smoking behavior. Smoking can damage the lungs and lower immune resistance, increasing the risk of TB infection or experiencing a more severe form of the disease. Non-compliance with health protocols. Lack of compliance with health protocols, such as using masks when coughing or sneezing, can increase the risk of TB transmission in the surrounding environment. Health service factors. Health service factors can also contribute to TB transmission, for example, infection control in health facilities. Insufficient infection control measures in healthcare centers can facilitate the spread of TB among patients. Delayed diagnosis. If TB is not diagnosed promptly, patients may continue to transmit bacteria before receiving appropriate treatment. Management of TB patients. The quality of handling and managing TB patients in healthcare facilities is crucial to prevent further transmission. This includes the selection of appropriate drugs, monitoring, and support during treatment. Access to health services. Unavailability or difficult access to health services can hinder efforts in the prevention, diagnosis, and treatment of TB.
TB symptoms. In latent TB, individuals generally do not experience symptoms. Typically, those affected only become aware of having tuberculosis after undergoing examinations for other illnesses. For active TB patients, the symptoms that may appear include persistent cough, lasting 3 weeks or more. Cough usually accompanied by sputum or coughing up blood. Chest pain when breathing or coughing. Night sweats. Loss of appetite. Weight loss. Fever and chills. Fatigue. When to see a doctor. Seek medical attention promptly if you experience TB symptoms, especially if living with or having close contact with TB patients. Early diagnosis and treatment can help reduce the likelihood of complications. To diagnose TB, doctors may conduct chest X-rays and TB tests. TB prevention. Efforts to prevent and avoid TB transmission include BCG vaccination. In Indonesia, the BCG, Bacillus calmette-guerin, vaccine is part of the mandatory immunization schedule and is administered before the age of 2 months. For those who have not received the BCG vaccine, it is recommended, especially if a family member has TB. Mask usage. TB can also be prevented by wearing masks in crowded places or when interacting with TB patients. Preventive measures include covering the mouth when sneezing, coughing, and laughing. Avoiding indiscriminate spitting or coughing up phlegm. Not sharing a room with others until the doctor declares the TB is in a non-infectious stage. TB treatment. The treatment for tuberculosis, TB, involves consistently taking medication for the duration recommended by the doctor. If a patient stops taking medication before the recommended time, TB bacteria may become resistant to commonly prescribed drugs. Consequently, TB becomes more dangerous and harder to treat. The TB drugs taken are a combination of 2 or 4 of the following: isoniazid, rifampicin, pyrazinamide, ethambutol. These drugs must be taken regularly for 6 to 9 months. Like other medications, patient compliance with treatment is crucial to avoid the risks of treatment failure, extended treatment periods, or drug resistance. During the treatment period, patients also need to undergo regular checkups to monitor treatment success.